Hello guys, so hope you are all okay. You are enjoying my videos and welcome back to Ultrasound Teaching Videos with Dr. Arshad Nadeem Awan. Today my topic of discussion is intrauterine contraceptive devices, which is also called as IUCD. Many books, many people researchers use a term IUD or IUCD. Both are the synonym. Whether you want to use IUCD or IUD, it doesn't make any difference. Intrauterine contraceptive devices are used for two purposes. The one is to control the bleeding, and the second is for the contraceptive purposes. For the contraceptive purposes, there are a certain intrauterine devices has been used. The one is copper coil. Copper coil happens to be in a circular shape, or you may come across in lip loops. It may be in a T-shaped form. So these are the three shapes of the intrauterine contraceptive devices. Either it will be appear in a T form, T shape, or it may be circular, which is commonly used in China, and it may be in lip loop. So these are the three shapes of the intrauterine contraceptive devices. Copper loop T shape intrauterine contraceptive device is used for long purposes for about 10 years. As far as levonorgestrel releasing intrauterine contraceptive device, which is called as Mirena coil, this is used for 5 years. This is more commonly used for the controlling of the bleeding rather than the contraceptive. Another coil, which is smaller than the Mirena, is also levonorgestrel releasing IUCD. It is used for 3 years. So it is depend upon the patient condition and the patient choices, whether they want to use for 10 years contraception, or they want to use for the 5 or for 3 years either contraception or bleeding, for the bleeding controlling purposes. So these are the purposes of the intrauterine contraceptive devices. How it will appear on the ultrasound images. So for the copper IUCD are concerned, it appears bright, ecogenic, and you cannot miss that, because ultrasound is one of the reliable method for the detection of the intrauterine contraceptive devices, for the positions and malpositions, for the detection of malposition of the IUCD. So therefore, ultrasound can be reliably used for all these IUCDs location. Intrauterine contraceptive device copper IUCD can be easily picked up because of this bright ecogenic appearances, which you will see on these images. The second is levonorgestrel releasing IUCDs Mirena coil, which is a bit difficult to appreciate on the transabdominal. For that, you need to have transvaginal. On the transvaginal scan, it can easily be picked, but on the transabdominal scan, if you see some shadowing coming out, it will give rise to aquastic shadowing, which will help you to identify that there is Mirena coil. The one confusing factor is sometimes a clinician confused with endometrial calcification and the Mirena coil. The differentiating point between both is that if there is any discontinuity within these ecogenic debris, so it would be calcification. And if it is continuing, so there is no loss of continuity and still you can appreciate the aquastic shadowing, it's mean that this is Mirena coil. So this is what the differentiating feature for the Mirena coil. Take history, ask the patient which type of a contraceptive she is using, and then accordingly look for the images. If it is possible, do transabdominal and pick the point. If it is not possible, so then go for the transvaginal scan. The another important point for the with respect to IUCD scanning is malpositioning. Many a time patients say that I suspect that I have lost the coil, or during the examination, gynecologists cannot appreciate whether there is intrauterine contraceptive devices in situ or not. So for that purpose, they refer to the radiology department to localize the IUCDs. IUCD must be in the upper uterine segment. If it is not in the upper uterine segment, so look for the lower uterine segment or low lying IUCD. It may be in the cervical cavity. If in that condition, always suspect that their both arms would be penetrating in the myometrium, or it would be embedded within the myometrium. So therefore, pay attention its positioning. I was going through one of the literature in which they mentioned that always give the measurement of the upper end of the IUCD and the fundus. So the distance between, the thickening between the upper end of the IUCD and the and the fundal region, this should have been less than 5 millimeter or 6 millimeter. This is what certain researcher and books says. And practically, it is not the case. It should have been from 12 to 15 or 16. That is considered to be a normal position. So still there are a lot of confusion, and it depends upon practically approach, how many time you did this practice. So but try to measure all that and make your idea, and you will come across the, and always measure the distance from the fundal region. If it is beyond then 20 millimeter, so that would be considered as a low lying. And if it is expelled down to the cervical cavity, it means it is malposition. And always suspect that there is, both arm must be embedded in the myometrium. The third point is, sometime this intrauterine contraceptive device may expel in the adnexal region. For that matter, you need to have the radiograph. During the radiograph, you can pick easily the presence of the IUCD around the uterine or around the perimetrial region. But on the ultrasound, you cannot pick because of the bowel gases. So it is best to have the radiograph. So these were all the points related to intrauterine contraceptive device. And let's start watching these videos, how the copper T will look like, and how the Mirena coil will appear, and how you will appreciate the low lying, and how it will be penetrated in the myometrium. So this is all the point which will help you to appreciate all these normal and abnormal position of the intrauterine contraceptive devices. So let's start watching these images. This is a transvaginal scan, and on transvaginal scan you can appreciate normal uterus. It is anteverted, anti-flexed uterus, and within the endometrial cavity you can see that there is echogenic, bright echogenic IUCD. As I mentioned in my earlier talk, that there are three types of the IUCD. It may be copper T, or it may be Mirena coil, which is made up of levonorgestrel releasing IUCD. It may appear in a T form, it may appear in a ring form, and it may also appear in some other forms as well. But here we are going to discuss about the different types of the IUCD and its appearances on the ultrasound imaging. This is what the copper T is. Copper T can easily be appreciated, can easily be distinguished from the other Mirena coils and from other intrauterine contraceptive device because of its higher reflective echogenic pattern. Here on this ultrasound you can appreciate a well-defined echogenic, brightly echogenic pattern with the acoustic shadowing as well. This is copper T. Although if you do transabdominal scan, so on the transabdominal scan this copper T IUCD can easily be picked up. And if you do its a transverse slice, so on the transverse slice you can appreciate its upper bilateral both sided arms as well. Normally it should have been in the upper part of the uterus. Their both arms should be in the upper carnal part of the uterus. That is the normal position of the IUCD. And if IUCD is slightly slipped, so that will be called as a low lying IUCD. Always mention whether this is normally placed in situ, or it is low lying, or it is slipped from the cervical canal. If in case of slipping, sometime you can appreciate part of IUCD in the cervical canal, and you must document that. But in few cases this might slip down to the adnexal region, or the third form is it might penetrate the myometrium and goes into the endometrial or into the adnexal region. If in that case you are not able to appreciate either on transabdominal or transvaginal scan, so for that purpose you need to have an X-ray abdomen or X-ray pelvic cavity, so X-ray will pick up all these intrauterine IUCD. This is transvaginal scan, and on the transvaginal scan uterus is anteverted, anti-flex, there is no flexions abnormality, clearly visible uterus you can see here. Within the endometrial cavity there is intrauterine contraceptive device which is in normal position. This is Mirena coil. Mirena coil having levonorgestrone releasing contents, but the one important thing is if you compare it with the copper T, you can appreciate that on ultrasound imaging copper T is more ecogenic, more brighter than the Mirena coil. This is one of the confusing point. Many a time clinician miss this findings, and instead of writing Mirena coil in situ, they write that endometrial thickening is blah blah blah. They take the endometrial measurement, they confuse the Mirena coil contents with the endometrial thickening, or many a time they confuse Mirena coil with the endometrial calcifications. So it is always best to ask the patients for the insertion of intrauterine contraceptive device. Always talk and always take the history whether she has any intrauterine contraceptive device in situ or not, and especially ask for when she had put that, because contraceptive device is used for 10 years when it is copper T, and it is used for 5 years as well when it is Mirena coil, and another form of Mirena coil is also used for 3 years as well. Important point related to Mirena coil is Mirena coil is usually used for the stopping of the bleeding or controlling of the bleeding. So there are two main purposes behind the Mirena coil, which contain levonorgestrone releasing contents, either to stop the bleeding or to control the bleeding or as a contraceptive device. But in practice Mirena coil is rarely or seldom used for the contraceptive purpose. Mainly its usage is for to control the bleeding or to stop the bleeding at all, or to control the normal menstrual cycle. It is always suggested that whenever there is Mirena coil history, go for the transvaginal scan, because on the transabdominal you cannot easily pick this Mirena coil. It will mimic as a calcification, but on the transvaginal scan you can easily and clearly pick the intrauterine contraceptive device of levonorgestrone releasing contents. This is another transvaginal scan, and on this transvaginal scan you can appreciate a circular IUCD. This circular IUCD is also in the market, usually used in China, not very common in the European or in the Asian areas apart from the China. This is usually used for the contraceptive, as a contraceptive device. Sometimes it is also used to control the bleeding as well. Its appearance is always in round shape. So whenever you are scanning on the transabdominal, you may be able to see this on the transabdominal scan as well. On the transvaginal scan it would be clearly visible. If the clinician is not expert or he or she has not seen this circular IUCD in before, so he or she may confuse with BPD. He will start taking biparietal diameter. He may think that this is either BPD, or he may or she may confuse with the fibroid, calcified valve fibroid. So these two are the misconfusion. Be careful whenever you are bump into circular IUCD. Always look for these 2 points as well. Do not confuse with either the fetal head or with a calcified wall fibroid. Always ask relevant history while you are scanning. It is always recommended to do both transabdominal and transvaginal scan. First go for the transabdominal and to have a clear view for the abdominal and the surrounding uterine area, because on the transabdominal you can see a lot of areas including the adnexal part. If there is any adnexal pathology, you can easily pick on the ultrasound, transabdominal ultrasound imaging. Transvaginal scan will give you a clear picture of the uterus, the uterine cavity and ovaries. So if in case you suspect any abnormality related to endometrium, always go for the transvaginal scan. If you have been asked to look for the endometrial thickening, go for the transvaginal scan. If there is any query for the presence or absence of intrauterine contraceptive devices, you must do transvaginal scan. On the report, mention that which type of IUCD have you seen, whether it is Marina coil or it is copper T or it is circular IUCD, and then also confirm it is normally within the situ. This is 3D ultrasound image, and on this image you can appreciate copper T intrauterine contraceptive device. This device is highly reflective, and you can see the both arms which are in the upper part of the uterine segment, so you cannot easily miss. If you are doing 3D ultrasound imaging, it will show you in all 3 dimensions. So here in one image you can appreciate the endometrial cavity clearly. Within the endometrial cavity, this copper T is properly placed. Copper T or any other intrauterine contraceptive device should have been in the upper segment of the uterus. If in case it is low lying or it is in the cervical region, this is likely possibility that their both arms should be embedded, would be embedded within the myometrium. So there is chance of perforation. So be careful. Mention whether the IUCD is in its normal position or not, or intrauterine contraceptive device is in low position. Always take the measurement from the fundal until the upper end of the IUCD. So this will help you to estimate whether the IUCD is not in normal position or not. Normally it should have been between 15 to 20 mm, while so far the books are concerned, and books and researchers say that this should have been up to 5 mm. Practically this is not applicable. During the practice you will see that this will range from 12 to either 18 or 20 millimeter. So if the fundal height or the fundal distance is within that 12 to 20 mm, so this should be still considered as normal. If it is more than 2 centimeter or 20 mm, then you can label the case as a low lying intrauterine contraceptive IUCD. If the IUCD is in the cervical area, so definitely it is gone down to a lower extent. So mention that uterine cavity is empty, intrauterine contraceptive device is seen in the cervical area. So this is the 2 methods you have to apply for the contraceptive devices. And if intrauterine contraceptive device is not visible, advise X-ray pelvis to rule out any pelvic intrauterine contraceptive device. This is transvaginal scan, and on this transvaginal scan it is beautifully explained here that intrauterine contraceptive device is within the myometrial parenchyma. Their both arms are penetrated within the myometrial parenchyma. Beside this, the part of the IUCD can be seen in the cervical area. So this is improperly positioned intrauterine contraceptive device, and expulsion of this IUCD is imminent. So be careful when you are scanning. Always focus on this position of the intrauterine contraceptive device. In this image, upper uterine endometrial cavity is clearly visible. You can take the endometrial thickening as well. As far as IUCD is concerned, this is copper T, and both arms can be easily seen. Both arms are embedded in the stroma of the lower myometrium and in the cervical region. So this is likely to expel out. It needs further attention. because the function of the IUCD, so far the copper T is concerned, it is for the contraception purpose. So this purpose is no longer maintained. So therefore you must mention on the report that the uterine cavity is empty, endometrial thickening is whatever the measurement is, give the endometrial measurement, mention that intrauterine contraceptive copper T can be seen in the lower uterine segment in the cervical canal, and both arms can be seen embedded in the myometrium. This malpositioning cannot be easily picked on the transabdominal scan, therefore it is advised to go for the transvaginal scan. On the transvaginal scan, in some of the images, or if the clinician is clinician is not very expert, so he may miss this points, and therefore 3D ultrasound images would be very helpful to identify the malpositioning. On this transvaginal scan, you can appreciate normal uterus, endometrial cavity is clearly visible, endometrial thickening can be easily taken on this image. As far as this white arrow is concerned, it is indicating the string of intrauterine contraceptive device in the cervical region. It means that the part of IUCD has been expelled out. During the pervaginal examination, gynecologists can easily feel and palpate the IUCD because part of the IUCD would be out of the endometrial or cervical canal and can be easily picked up during pervaginal examination. In this case, what you need to do would be, you have to explain that the uterus is anteverted, uterus is antiflex, endometrial cavity is normal, endometrial thickening is whatever the thickening is, to mention the thickening of the endometrium, and then mention that highly echogenic reflective part of IUCD can be seen in the cervical cavity. So cervical cavity can be easily appreciated on this transvaginal examination. So for the part of IUCD which is out of the cervical canal, you cannot confidently comment on it, although you can advise that X-ray pelvis is advised. Radiograph would be helpful to appreciate how much part of the IUCD is out of the cervical canal. So this would be your perfect report if you clearly mention about all these things which you can appreciate on the ultrasound imaging. This transvaginal scan is another example of the low-lying IUCD. As I mentioned earlier, that there are three categories. Either the IUCD would be in normal position, so you can mention that IUCD is normal in situ, or the second possibility would be there will be low-lying IUCD. So here this IUCD you can see in the lower segment of the uterus, part of the IUCD can be seen in the cervical cavity as well. So it's mean that if it would have copper T, they both arms would be embedded in the lower uterine segment myometrial stroma. So there would be a likely chance of perforation. This is low-lying reflective copper T, and you can appreciate and you can pick on the transvaginal scan. So far transabdominal scan is concerned, it cannot be easily picked so far its position is concerned. Because of highly reflective material on transabdominal, you can pick the copper T easily, and if the clinician is expert, he or she may easily mention whether the intrauterine contraceptive device is in normal in situ or it is low-lying. This is the best example of low-lying IUCD. So compare previous images with these reports, so you will be able to understand how Medina coil will look like, how copper T will appear on the images, how the normally placed IUCD will look on the ultrasound imaging, on the 3D imaging, how you will appreciate a low-lying IUCD, how you will appreciate the IUCD which is about to expel. So all these images will explain all these things clearly. So go one by one, rewind this video and again look for the images, and I'm sure this would be quite useful video for understanding the IUCD. This image show Tubal occlusion devices. I would not recommend you because this is highly technical issue. and for the tubal occlusion certain devices can be used, and on the ultrasound images or on the transvaginal or transabdominal this cannot be easily picked. So far the 3D ultrasound is concerned, to some extent you can pick all these devices easily, but on the transabdominal and on the transvaginal scan it would not be quite clear. Best modality to pick the tubal occlusion devices are the MRI, because MRI will explain clearly everything. It will show you whether these devices are normally in situ, they have occluded the uterine fallopian tubes or not. The purpose of this image shown to you was to just make your mind clear about, just to have a clear understanding how the tubal occlusion devices will look like. If in some cases if you come across these devices, so you will not be confused, then you would be able to pick that this could be tubal occlusion devices. And beside this you can also ask the patient for the history or for the intrauterine contraceptive device, because patient would be knowing that she had any either contraceptive device within the uterine cavity or she has any tubal occlusion devices in situ. This is 3D ultrasound tubal occlusion device, which I have mentioned earlier, that as far as transabdominal scan is concerned or transvaginal scan is concerned, you cannot easily appreciate tubal occlusive devices. So only the method to confirm the tubal occlusion is through the 3D ultrasound, taking the history of the patient. If she is candidate for the 3D ultrasound, go for that, confirm whether there is tubal occlusion devices or not. If it is confirmed on the 3D ultrasound, fair enough. If not, always look for the MRI. MRI is the best modality to explain all these tubal occlusive devices. Yes, friend, this was all about the intrauterine contraceptive devices. So, how it will appear, how many types of the intrauterine contraceptive devices you come across while you are scanning. I have mentioned about the copper T, I have mentioned about the circular, which is very common in China, and I have also discussed about the lip loops, how it will appear on the ultrasound, how will you understand that this is normal in situ or this is malposition or it is penetrated or embedded in the myometrium or it has been expelled. So what you need to do is then you have to have the x-ray, you have to have the radiograph. So these all point has been already discussed. Beside this, I explained briefly about keeping in view the certain literatures that they say how you can give the measurement of the upper end of the IUCD and the fundal region, which is still I mean a dispute, nobody can confirmly say, but on the practical ground, which I have observed during my clinical practice, this should have been from 12 to 15 millimeter. So if this remain within that size, it means that the intrauterine contraceptive device is properly positioned and normal in situ. So hope this would be worth watching and you will enjoy these videos. If any question relating to all these you bump into or you have in your mind, just drop me a message. I will try to get back to you with any new topic, new video. We'll see each other. Till then, take great care of yourself. See you then. Bye bye.